So part 3, we return to mimics and dating in the setting of non-accidental trauma. First, we will start off with abuse mimics, things that aren't actually abuse, may be normal, and should not be confused for abuse. Here we have an older patient, and we see a sliver of bone here, and you may remember that classic metaphyseal lesion looks like a sliver of bone from the metaphysis. But in the older patient category, this elbow is a common elbow condylar fracture, which is objectively kind of similar in appearance, that you have a sliver of metaphysis that's been pulled off, but this is not a pattern of injury that you are worried about abuse. This is just routine injury to the elbow because of kids falling, playing sports. So this is not a classic metaphyseal lesion. This is just a condylar fracture. In this case, a lateral condylar fracture. You can have a similar injury pattern in the elbow on the medial side as well. The actual fracture itself goes all the way through the middle of the elbow, through the cartilage. The only piece that we can see, though, is that little sliver that's been pulled off. In a young developing humerus, you get kind of a funny appearance of the ossification centers, and you also will get a step off in the proximal humerus that one might be concerned represents displacement of the physis. It might be concerning for a metaphyseal injury, but it is entirely normal appearance. This will, by adolescent, completely fill in. It's just that in the early stages, these normal ossification patterns can be confusing to people who don't routinely look at pediatric x-rays. Here's another example. In the distal metaphysis, you can have this pointy little beak or spur. That is not a corner fracture. Now, if you saw it, you'd look hard at it because you always want to look hard at the metaphyses, but just know that a metaphyseal spur is normal. Similarly, if it points away from the joint, it's called a beak, as we see here in the young proximal humerus. That little pointy edge, that is normal. It's okay to have a little bit of bowing when you are a newborn. There are such things as bowing fractures. However, that is not something that's occurring here. This is just the normal physiologic bowing that will correct for itself as the baby starts to walk as a toddler, and then remodeling takes place. So one thing that might come up in court is, could this be osteogenesis imperfecta? And that is actually the cause of abuse and not due to any actual abuser. One should really only be invoking osteogenesis imperfecta from a radiographic standpoint when it looks like this. When there's just diffuse fractures, misshapen bones, osteopenia. There is on this femur view on the right, the classic telephone receiver deformity. These are the kind of injuries and appearances that would make you think of osteogenesis imperfecta. You're not going to invoke it on a normal mineralized skeletal radiograph. Otherwise, it can be used by the defendant attorney to say, oh, this is not due to abuse. This is just because the patient has a condition. Here's another example of osteogenesis imperfecta, what it looks like in the skull. It's okay to have a few Wormian bones in a normal skull, but these are innumerable Wormian bones throughout the sutures. That is classic for osteogenesis imperfecta. So again, these are classic findings. One should not be pushed to invoke osteogenesis imperfecta unless you have these classic findings. So lastly, we're going to talk about fracture dating. We should say from the outset that fracture dating is inexact. Anyone who claims to say this is within hours or minutes does not know that. The best we can be in terms of temporal accuracy is on the order of weeks to months. In the acute setting, you won't have any healing changes. Now, this can take up to a few weeks before you actually see. So this fracture could have occurred a minute ago. It could have occurred 2 weeks ago. We don't know. It's in the acute phase, and the best we can be accurate is to degree of a few weeks. Here we see periosteal reaction. It takes a little bit of time for that to develop. So somewhere on the order of a few weeks, but beyond that, we don't know exactly when this injury occurred. And then lastly, in the subacute to chronic, there will be this overlap of mature callus formation, which takes a few weeks to develop and a few weeks to months to go away after the bone has fully healed and remodeled.